If someone was to ask me whether or not they should do the program, I would say, what do you want? What do you want out of your year? And if it's to make new connections, if it is to have a community, it is to have resources, it is to have educational opportunities on top of getting work experience, I would say that would be AmeriCorps.
I would, to be an effective Chickani's AmeriCorps member, you definitely need to have an open mind. You also need to be open to different opportunities.
This is a great opportunity to hit the ground running to see what areas they may like. Some members might decide, okay, if they're interested in medicine, maybe specifically family medicine, or maybe I can go into pediatrics or OB, just based on the experience here.
I've been contemplating going into the medical field for a long time. My AmeriCorps experience is definitely one of those experiences that helped me solidify my passion in medicine.
I've been here for about 3 weeks now, and I've been able to learn so much, things that I have been experienced prior to coming here, being exposed to healthcare, both in the medical setting as well as administrative setting. So learning something every day, it's been everything that I've hoped for and even more.
I think especially because of how challenging this experience can be, you have to have an open mind to who you are going to be working with in terms of your co-workers at the health center, in terms of your fellow members in the program, as well as the patients in the community that you are serving.
I personally know firsthand that AmeriCorps really kind of changes your life and it informs the rest of your life.
I was looking into AmeriCorps because I'm doing a career change. I'm 27 and decided that I want to combine Spanish and health, and Chickani's AmeriCorps was a great avenue to do that.
There's plenty of opportunities for me to continue my passion of improving community health through person-centered care, right, under the direct mentorship of a site supervisor.
I was taking a lot of pre-health courses, so I really wanted to get my feet a little wet and just try to get an experience where I can go into a community that I'm not familiar with.
Some of the assignments that the Chickani's AmeriCorps members have been working on here is working with the clinical team and implementing the substance abuse program, working on Narcan programming, and now our newest members working on COVID vaccine administration.
And we had members working at testing sites, directing people, signing them up, just in the front lines of COVID. These members are not in medical school and they get to tell their peers, I was in the front lines during COVID as an AmeriCorps member in the Chickani's Healthy Futures program.
During the turmoil of the pandemic, there were tough times, and I had people to commiserate with, and I had people to celebrate with, and I had people to troubleshoot with, which I think is such an important part of serving in any capacity, and especially in healthcare, and especially during a pandemic.
A lot of the projects that I was involved in also required working closely with the doctors and nurses. Along the way, I definitely developed really deep connections with those staff members as well.
We focus a lot on team building because we want our members to support each other. We are strong believers in peer networks and peer support.
It's great to have mentorship and friends and community, and I know I can go to them for recommendations, or I can go to them for advice.
Additionally, we always do a lot of checking in with the members, not just how their service is going, but just how their life is going.
This is a pretty difficult job. The patient population that we're serving, the homeless, uninsured, underinsured, they go through a lot, and sometimes they're dealing with substance use disorders as well as multiple underlying chronic illnesses. But having very supportive AmeriCorps peers has been really helpful in helping with that.
This community especially needs a lot more resources than the communities that I've been part of, and so when you don't have the resources, it's hard to know how to advocate for yourself. Just being a case manager, being able to kind of show them ways they can succeed, and then letting them take the reins from there was really rewarding.
Through AmeriCorps, I really learned what it means to be empathetic, really seeing the social determinants of health and how that impacts people's lives.
I learned a lot about my resilience. AmeriCorps is hard, you know? You are doing a service year, so that means all the things that come with doing service, which is it is not paid to maybe the extent that another opportunity would, but it kind of gives back, I think, in spades.
What we always hear from our alumni is my experience really helped me during my interviews for medical school, during my interviews for grad school, because I have hands-on experience. So I think having done AmeriCorps, it's very valuable moving forward in your career.
Now this is the springboard for the rest of my career in medicine and hopefully community healthcare after I go to medical school.
AmeriCorps provided me the structured program that I was looking forward to get hands-on work and direct experience with patients in different communities that I have not been a part of yet.
I see the world differently. I see my own community differently. I see my friends and family differently. You start to pick up on little things and you come to work and it's like, wow, okay, this is really different. And you start to shift your whole perspective, you really do. And it's both wonderful and difficult and amazing all at once.
You are going to be changing lives, changing the quality of life in your community for the better, based on the work that you are doing as an AmeriCorps member.
Being in this position, seeing how the social determinants of health affect people was really enlightening into thinking about how to take care of people in a deeper way.
Can I just say, through AmeriCorps I loved, because for me, that's what service and community membership and friendship is. That's what you're giving, and it's what you're getting.